Okay, this afternoon I have with me Mark Eichenbaum, who's the Special Assistant for the Mayors on the issue of homelessness, and then Chief Pena with the Fire Department, and Director Williams with the Health Department, and Dr. Purse, the Chief Medical Officer for the City of Houston. Before we get started today on today's COVID-19 numbers and discuss the vaccines that the Houston Health Department will receive this week, I want to focus first on a project important to the City of Houston. With the holiday season upon us, it's important that we reflect on this past year. And although 2020 was a year like none other, there is much to be grateful for, including incredible work accomplished throughout the city that often went unnoticed and unrecognized as we focus on the pandemic. One such program is the Housing Harvey's Homeless, also known as H3, concluded just weeks before the first confirmed cases of coronavirus hit Houston. And this project, of course, was led by Mark Eichenbaum and his entire team, along with the coalition and many others. This ambitious program aimed to house 140 of our most vulnerable residents experiencing homelessness on our streets and at our largest encampment near Minute Maid downtown. Within months, the program did not just meet, but beat expectations by permanently housing with wraparound supportive services 173 people. Nearly 95% of these individuals were still housed 6 months later. H3 also helped us holistically decommission our region's largest encampment. By permanently housing all the encampment residents, the number of inhabitants on the 900 block of Chartres went from 102 to 0. This program could not have been done without the state of Qatar, which generously invested $2.5 million to finance H3 and reduced homelessness through the Complete Communities Improvement Fund. Of the $30 million that the Qatar Harvey Fund committed to help Texas recover in the year following Harvey, I don't know if there was a better, more transformative project than H3. I also want to thank the Coalition for the Homeless for leading this endeavor and 13 other local agencies that worked hard to make this program a success. I want to thank Mark for providing leadership for this program. And more than just the lives transformed, this initiative has set the stage for how we respond to homelessness and encampments in the future. As part of our community COVID-19 homeless housing program with Harris County, we are currently planning to expand upon the targeted housing surge successfully utilized through H3 to respond to encampments and hotspots throughout the city. And once again, I want to thank, on behalf of the City of Houston, I want to thank Qatar for your friendship, for your generosity, and enduring commitment. And as you can see, the results speak for themselves. Mark, anything you want to add before?
Mayor, I just want to thank you. During the holiday season, Houstonians' attention turned specifically to those that are vulnerable and in need. But Mayor, your attention on our vulnerable population is 24/7 all year round. And I'm thankful that you work with Qatar to dedicate these funds to helping get these 170 individuals off of our streets so we didn't have to respond to them in the crisis of COVID. They are housed, and they're housed today. What's beautiful about this is that it's setting the stage for this very comprehensive encampment strategy that we're working on and planning right now, and look forward to announcing in the months to come to decommission all the major encampments in the region. There's 13 agencies that work together on this, but it could not have been done without Qatar. We're very, very grateful. Thank you.
Thanks, Mark. A few weeks ago, the City Council passed $20 million in direct assistance to assist Houstonians facing financial challenges as a direct result of the pandemic. Baker Ripley is handling the program and continues to provide direct financial assistance checks according to the established targets. As of today, December 21st, 12,278 checks have been sent out, totaling $733,600. And another check disbursement is scheduled for Wednesday, December the 23rd. We are on target to have all $20 million allocated for the Direct Assistance Program paid out by December 30th, 2020. Recipients are from the Harris County Direct Assistance waiting list and from other City of Houston COVID-19 assistance programs. More than 70 Baker Ripley staffers and temporary workers are certifying recipients and processing checks to get these funds to Houstonians by the end of the month. And as you know, each one of those checks will be for $1,200. And I want to thank those workers because this is not an easy task. Today, the Houston Health Department reports 777 cases of COVID-19, bringing Houston's total to 111,211. There are, unfortunately, 3 more people who have died as a result of COVID-19, bringing the city's total to 1,530. Each one of these individuals represent families within the city of Houston. The positivity rate is also up this week in comparison to last week. It is now 11.2% compared to 10.5% last week. And again, it is a reminder that it's important for us to blunt the progression of this positivity rate and then to start working to bring it down. As a result, I'm urging everyone to please get tested before Christmas Eve. Please get tested. There are many free testing sites very close to where you live. More importantly, please, I'm asking people to cancel your holiday gatherings. If you've planned to gather, especially outside of your immediate household, I'm asking that you delay those activities. To avoid a surge on top of a surge, postpone traveling until sometime next year. I know a lot of people are flying from here to there. I just don't think that is a wise thing to do right now. Cancel holiday parties and receptions, including those at your home. Wear your mask, wash your hands, and get tested this week. There is, of course, hope on the horizon with the approval now of 2 vaccines. This week, the Houston Health Department is scheduled to receive 3,000 doses of Moderna's COVID-19 vaccine. In addition to that, the Houston Fire Department is also scheduled to receive the same amount, and then I'll let Chief Pena speak to that shortly. The Health Department will distribute the vaccine in accordance with the vaccine allocation guiding principles established by the Texas Department of Health. Phase 1A of the Texas Department of Health plan focuses on making vaccines available to healthcare workers, including public health staff directly involved in administration of COVID-19 testing and vaccinations. And the Health Department is coordinating with the home health care agencies, long-term care facilities, and EMS providers to serve Phase 1A populations that are not yet connected with vaccine providers. In addition to that, her task force is putting together another advertisement media campaign to encourage people to get vaccinated. And I think the award-winning producer, Susan Christian, along with her co-director, Shannon Buggs, have put this television commercial together along with Denzel Washington. We can have the commercial. I am proud of how many Houstonians have responded to this pandemic. Now that COVID-19 vaccines are becoming available, continue to mask up, social distance, and follow health protocols.
As trusted healthcare professionals,
We're here for you.
we know some folks have concerns about the vaccine.
And we're working together with the mayor to address them.
Let's have a conversation about the vaccine.
About the science and the facts. And stop the rumors.
You bring the questions, we'll bring the facts.
Because the truth can save lives. Thank you so very much. And now let me bring up the co-star of that commercial, Dr. David Purse.
Thank you, Mayor. I'm still, I don't know about you, I'm still waiting for my SAG card, but we'll see. So I just want to say a little bit, so we've been in the media, there's been a lot of talk about what's going on in the UK with a new variant of the COVID virus, of the mutation. And it's important that everyone understand that it appears early on that the virus, the new mutant virus, does not appear to be any more lethal. It doesn't cause any more serious illness, doesn't cause any more death. The change appears to be that the virus is more easily transmitted. And if you recall, we saw this back in late spring, early summer last year. Also in Europe, there was a mutation. So this is the second significant mutation to occur. And this is important because I want everyone to understand what happens. Anytime somebody becomes infected with the virus, their body starts making copies of it. And this is why we get so much virus, we can then spread it to others. Every time a cell makes a copy, there's a risk that it will make a mistake and that it will make a copy with an error in it. Well, that error, if it is functional enough that that new virus can propagate, that's called a mutation. And so every time somebody becomes infected, we run a risk. So of all the many, many, many reasons we've talked about why people don't want to become infected in the first place, now here's yet another one. So I'm looking at this, of course, I look at it from a worrisome standpoint, is that we've now had two significant mutations that have caused the virus to spread more easily, but have not made it more lethal. And so what we really don't want to have happen is to have a virus which is easily spread and makes people sicker or is more lethal. So yet another reason why we should all be very, very diligent about making sure that we protect ourselves. Now, at the same time, I want people to understand, this new virus, the new version of it is not more lethal. It does not make people any sicker at this point. And also importantly, it appears that from those folks who are the scientists there, that it appears that the vaccines will still work against this new mutation. So those are all very good news, and those are all important news. But I just want to underscore, there's yet another reason for folks to protect themselves and not get infected in the first place, because certainly you don't want to be the one whose body inadvertently makes the mutation that causes even more problems, right? And then the last thing I want to point out is that we talk about just to give you an idea as to how much more easily this virus is spread. We've talked about the R value. You see that the mayor has talked about the R value, and we get from the TMC. If that number is greater than 1, the virus spreads more easily. If it's less than 1, the virus is slowing down. And it's really a value of not only of the virus, but also how it's behaving in the community. So the numbers are early, but with this new mutant, it appears that it might be in the neighborhood of 3. So that is a significant increase in its spreadability. It's limited to southern England, southern UK at this point. And those officials there are on top of it. And so I heard on the way over here, apparently, that France is not letting anyone from England come. So there's some degree of international quarantine going on. And let's hope that they're able to get on top of it and stuff. But the bottom line is, even in the UK, in order to stop that, individuals are going to have to take responsibility and do whatever it takes at the individual person level to stop the spread of the virus. And Houstonians, we've done this. We've done it twice. Our numbers are going up now. It's time for us to do it again.
Thank you. Director Williams is a city's representative that sits on the state's, advisory committee dealing with the dissemination of the vaccines. Director Williams, you want to add?
Thank you, Mayor. Just from my participation on the advisory committee's perspective, right now we are in the process of deliberating around what that next level of priority population would be. Certainly the health commissioner has already accepted our initial recommendation regarding 1A, which is centered around healthcare professionals, and I think everybody has really talked about that: hospital staff, long-term care staff, EMS providers, home healthcare workers, residents of long-term care facilities. And if you look at the next tier of that, it would include those people who are working in outpatient settings, direct care staff, community pharmacy staff, public health, emergency response staff, last responders, and of course, school nurses. Our department, as the mayor said earlier, are really reaching out to these various groups to ensure that those people or individuals that are in these priority populations actually have a source to get the vaccine. We've contacted over several hundred organizations to ensure that there is connection. We're anxiously awaiting to see whether or not the recommendations for what we're calling 1B are actually approved by the health commissioner. We look forward to seeing what that looks like at the national level. We know that recommendations for those individuals that are 75 and above and frontline workers has been approved, but that does not mean that the state will adopt those same standards. So we are anxiously awaiting to see exactly what's that going to look like from the state's perspective.
Thank you. And as I indicated, in addition to the city of Houston receiving 3,000 doses sometime this week, the Houston Fire Department will also be receiving a separate allotment of 3,000. And Chief Penn, you can speak to that.
Thank you, Mayor. It's hard to follow the two commercial stars, but I do have good news. The Houston Fire Department staff, the EMS staff, and our infection control staff applied for, and we've been approved to be providers for the coronavirus vaccine. We have also been informed that we've been allotted 3,000 dosages that will be received along with what the health department receives it, or when they receive it, either this week or next week. But either way, we're prepared to receive that inventory. We have the tools and the equipment to properly store the equipment, and a plan to administer those vaccines to those employees who want to take advantage of the opportunity. Until then, our employees have access to and have actually taken advantage of the vaccines that are offered by Methodist and HCA. So we're proud of our employees and those that are taking advantage of this opportunity. But we will be making those vaccines available to our personnel in-house. Primarily, we're going to vaccinate our employees. As soon as the Phase 1 Bravo group is approved, then we will be prepared to also assist with that. But at this moment, only the Phase 1 Alpha employees for the Houston Fire Department will be eligible to receive that vaccine, which means that the support operations, the functions that are filled by support personnel, at this moment don't qualify. But as soon as the decision is made for the Phase 1 Bravo group to be eligible, then we'll be prepared to administer those. In regards to our quarantines, the Houston Fire Department, we continue to be plagued by infections and quarantines. Today, we're at 180 firefighters that are in quarantine. We have 46 that have tested positive or are currently positive for the virus, and a total of 421 that have tested positive since the pandemic began. So we continue to implement our safety protocols. We continue to support our firefighters to ensure that they're receiving the tools and the equipment, and now the vaccine for this virus, in hopes of combating this and making inroads on that. So that's my report. Thank you, Mayor.
It's been over a little over 9 months while we've been dealing with this enemy, and so let me thank people who have been very vigilant, very patient, have adhered to the protocols that we've been articulating for over the last 9 months. Let me encourage people to take the vaccine. When their number is called, please do so. I would encourage you to do so. That is the way that we'll put this virus behind us and move forward. And so again, as we approach Christmas is coming up on Friday, Christmas Eve on Thursday, let me again discourage people from traveling, from gathering outside of their immediate household family, to cancel all of your holiday parties and receptions. And I won't say cancel, just put them in 21. Just reschedule. Let's put it that way. If you will reschedule till 2021, then we'll be in a much better state. And then I promise you, if you invite me, I will show up. And I will come. You know, if you just put them till next year, and then extend me an invitation, I will show up either in person, via Zoom, or in spirit. But let's hold off for this year, and let's all work together to transition to 21 in a healthy and a safe way. Having said that, if there are any questions, any one of us can take them at this time.
Mayor, this is for Dr. Purse. So in total, how many vaccines will be in the city of Houston, and who will get it and when?
So that'll be a moving number, right? So in this first wave, if you will, if you let me use the word wave, of vaccine is coming, there'll be 3,000 doses going to the health department, 3,000 doses going to the fire department. And so between the two departments, so the fire department is laying plans to administer that vaccine to firefighters, those predominantly, focusing on the ambulance work, the ones that meet the Phase 1A Tier 1 criteria, because it's part of the agreement between the state. That's why they got it. And with the health department, we're going to be looking at those folks that meet the criteria they're on here. So you'll see that there are and I think it's scroll down. It's those that are directly involved with interfacing with the testing, and then we're also going to be working with our other community partners for people who meet these criteria but can't otherwise get tested, or I'm sorry, get vaccinated. And so we're working with them to make sure that there's vaccine made available to them. And of course, there's a myriad of examples there, so it's a little bit difficult to describe. But there are a lot of folks who meet these criteria but don't have somebody give them the vaccine. So we're going to make sure that they get vaccinated.
Okay, so for the essential workers who technically are next to get the vaccine, who does that include at the city? When will they get it, and how do they sign up?
So, Stephen, do you want to?
Yeah, I think everybody is really anxious to see what that next level of priority populations would be. But as I stated earlier, right now, from a state's perspective, we're in Phase 1A. There is 2 categories of 1A. And what you're looking at on the screen now is Tier 2 of 1A. There has not been the acceptance or designation for what we term as 1B yet. Actually, we were having conversations earlier. We're anxiously awaiting that. What you're referring to is actually the recommendation from CDC. It's yet to be seen whether or not the state will actually change current recommendations to be consistent with CDC's recommendation. Because states do have some flexibility. What you're getting from CDC is general guidance. And they've left enough flexibility so that states can actually consider what's going on in their particular state that doesn't necessarily mirror what's happening at the national level.
And last one for Mayor. Mayor, state and local government aid was not part of this recent COVID relief bill. What impact will that have in Houston the next coming year, and in terms of layoffs and service reductions?
And it was unfortunate that local governments were not included in this initial relief package. Bear in mind, for local governments, we are talking about police, fire, public work employees, municipal employees, healthcare employees, parks, people who take care of your water. And in terms of our revenue stream, I just had my meeting today with my finance department. The city is falling short of not receiving, let's say, about $150 million in sales tax as a result of the COVID-19. That is highly significant. That's highly significant. And so we are like the only business, so to speak, because we are a public corporation that are not receiving any additional support for the revenue stream that we have lost. I cannot tell you how disappointed I am with Congress that they did not include local governments in the stimulus package. To say that they're going to come back later on, it may or may not be included. And for us, our budgets are due after balance by the end of June. So it may not even be in time for the city of Houston. But their failure to include local governments in the equation could have a very significant adverse impact on the services that have to be provided to the people in the city of Houston. We'll take it in stride. We'll do what we must to make sure that we meet the priority needs of the people in the city, as we have done in the past. They certainly didn't make our task easier, but we'll keep moving forward. Having said that, I'm glad that they did do something, and hopefully the relief that they're provided will get to the people who stand in need as quickly as possible. So I'm glad that they did just do something. But I am very, very disappointed that local governments did not receive any assistance in this package.
And lastly, since your Spanish is too good, can Chief Peña speak on the vaccines that they will receive?
See, but I was prepared with my tutor to do better. 2021 will be my, I'm going, I'm just going to start off my press conference speaking in Spanish. I just, and ask you to catch up with me. But 2021 will be my year. Okay, Chief Peña.
Yes, sir. Bueno, mire, la ciudad de Houston va a recibir más o menos 6,000 vacunas de la compañía Moderna. El Departamento de Salud va a recibir 3,000 de esas vacunas y el Departamento de Bomberos va a recibir otras 3,000 vacunas para poder vacunar a nuestros empleados. Los empleados que califican ahorita son los de la fase 1A y son los empleados que están, que su trabajo involucra dar servicio a las personas de emergencia para nosotros. Y esas vacunas van a ser recibidas estas semanas, es cuando se esperan, o la semana que entra, pero nosotros, la ciudad de Houston, está preparados para recibir esas vacunas, para almacenar esas vacunas y para poder administrar las vacunas apropiadamente cuando lleguen, y los planes ya van en pie para poder empezar a vacunar a nuestros empleados.
Okay.
Is there a local plan in place in regards to the mutations we're seeing in the UK?
Yeah. So at this point, there's not a lot that we can do differently. So as I think of answering the question, the first thing is it'll be up to the CDC to put in whatever provisions at the federal level to restrict movement of people from the UK to the United States, if they're going to do that, right? That's not our call. That would be at the federal level. That would be something they could do. Then if that virus, that strain should show up in the United States, then it would be intrastate travel and trying to keep it from moving to all major metropolitan areas. The challenge is that in testing, the testing we have today, you're not going to be able to tell one strain apart from the other. That requires going to the lab and doing the sequencing. Now, we're fortunate here in Houston that we've got laboratories that are doing that. So we will partner with them to see if it pops up here. But there's not, because it's a virus and because it spreads easily, there's not a lot we're going to be able to functionally do to slow it down other than to hope that it doesn't get here in the first place. So this, again, is why I point to the federal government and really the federal government to try and keep it from coming here. It doesn't require any different treatment that we can tell at this point. The vaccine appears that it will work at this point. So again, it goes back to what we said before. Individuals wearing the mask, social distancing, washing their hands, et cetera, and now getting vaccinated as soon as your turn comes up. Take the vaccine.
Thank you.
Lastly, again, I do want to emphasize the importance of taking the vaccine. I've had a number of conversations with people over the last week or so, Dr. Person, Dr. Williams, Chief Peña, and I'm talking about people that I know, friends of mine, African Americans, who are indicating a reluctance to taking this vaccine, and kind of surprised me with some of the people that I know. So let me just say almost every day when I stand before you, I talk about the number of people who have contracted this virus and the number of people who have died from this virus, with there being a disproportionate impact on people of color. So let me encourage you, when you have the opportunity to take this vaccine, please take this vaccine. Because this is an insidious virus, and it's having a detrimental impact on people, not just in our city, but throughout the world. So it's not like this thing just came about, but I will encourage people, please, give it a lot of thought. Talk to your healthcare providers, talk to your doctors, to the people that you trust. But when your number is called, let me encourage you to take the vaccine. I intend to do it when my number is called. Will encourage all of my family members to do it when they're eligible to receive it. But that's the only way we're going to be able to contain and get rid of this virus, or at least put it behind us. is that if we take it as a community and we take it in large numbers. So please, when your opportunity presents itself, let me encourage you to take this vaccine. Okay, thank you.